Sure.
So what would you say is Mpox?
So Mpox is it's not an old disease or illness. Mpox is an illness that is caused by viral infection.
Oh, is it?
So this is the virus that was formerly known as monkeypox.
Okay.
But the feeling by the World Health Organization was that when you say monkeypox, because we have big problems with stigma, especially with new types of illness, so the decision was then to call it Mpox rather. So that's what Mpox is.
That's very valid. All right, so what would you say are maybe the signs and symptoms? How would I know that I maybe have Mpox?
Okay, so to begin with, I think the first part is if you have been exposed to someone with Mpox, you need to be very kind of observant of an onset of certain symptoms. So this includes what would generally feel like a flu-like illness. You feel like a bit fluey, body pains, feverish, maybe a headache, feeling very, very tired. So these symptoms are very non-specific because even when you get the flu, you get the same type of symptoms.
Of course.
But it is then followed within a couple of days by a rash. So that is a typical telling sign that it possibly is Mpox. And this rash has a particular characteristic, which includes where it is specifically. So you can have it on your face, you can have it on the body, in the groin area, but most distinct is the fact that you might have it in your hands and feet.
Oh, under your feet or on
under
your feet?
So
oh, wow,
under your feet in the palms of your hand.
Of course.
So it starts out as little vesicles, like water-filled little pimples. And then it progresses. It takes its own time. It can last anything from a week to 3 weeks. During this time, it progresses from these vesicles with clear fluid onto something that looks like a pussy collection within the pimple. And then over time, it starts to kind of dent in the middle. And then it starts to dry, and then it becomes a scab, and then it falls off. So this is the typical characteristic of Mpox. So it's suggested as soon as you start having this rash, you must realize that, one, the only way to know for sure it's Mpox, you need to go and get tested.
Of course.
Once you test it and we know it's Mpox, then you need to isolate.